The same company that created your headache medicine also created one of the most addictive street drugs in history. They even advertised them on the same billboard. This is the story of Bayer. In 1897, a chemist named Felix Hoffmann synthesized both aspirin and heroin within a 2-week period. Bayer aggressively marketed heroin as a safe, non-addictive cough suppressant for children, while also selling aspirin. They literally created the problem and the solution, profiting from both sides of the coin. When the world became ravaged by heroin addiction, the drug was banned. But aspirin? It became a household name, solidifying Bayer's wholesome image. This isn't ancient history, it's the business model. Create a disease, sell a cure, and control the entire narrative. It's the original sin of Big Pharma, and they've been repeating it ever since.
The man who monopolized the oil industry is the same man who created the modern medicine you rely on, and he did it by destroying all the alternatives. Before the 1900s, medicine was a diverse field of natural remedies and holistic practices, but oil tycoon John D. Rockefeller saw a massive business opportunity. He wanted to replace all plant-based medicine with petroleum-based synthetic drugs that he could patent and control. So he systematically funded only the medical schools that agreed to teach his version of medicine, pushing out all forms of natural healing and labeling them as quackery. He used his immense wealth and political power to create the American Medical Association and lobby for licensing laws that made his competition illegal. The entire medical system you know today wasn't designed for your health. It was designed as a business model by an oil baron.
There's a morning sickness pill that caused over 10,000 babies to be born without limbs. The company knew it was dangerous and sold it to pregnant women anyway. In the 1950s, thalidomide was marketed as a wonder drug for anxiety, insomnia, and morning sickness. It was sold over the counter in Germany and prescribed in 46 countries, promoted as completely safe for everyone, including pregnant women. But the company, Grunenthal, had never tested it for its effects on a developing fetus. When thousands of babies were born with severe deformities, sealed eyes, malformed organs, and flipper-like limbs, the company denied any connection. They continued to sell the drug for years, covering up the evidence and blaming the mothers. The thalidomide scandal forced the creation of modern drug safety regulations, but the core lesson remains. For pharmaceutical companies, profits will always come before people, even if it means destroying lives.
Before the FDA, the most popular medicines in America were secret formulas filled with cocaine, opium, and pure alcohol, and they were sold to children. Welcome to the era of patent medicines. In the late 1800s and early 1900s, companies could sell any concoction they wanted, with no regulation and no ingredient lists. Mrs. Winslow's soothing syrup, a remedy for teething babies, was loaded with morphine. Coca-Cola originally contained cocaine and was marketed as a health tonic. These miracle cures promised to fix everything from cancer to baldness, creating the nation's first mass addiction epidemics. The marketing was identical to today: celebrity endorsements, emotional testimonials, and wild, unproven claims. The only thing that has changed is the branding. The modern, unregulated supplement industry is just the 21st century version of the same snake oil playbook, preying on hope and desperation for profit.
The scientists who discovered insulin sold the patent for just $1 so it would be affordable for everyone. Today, that same drug costs over $300 a vial, and people are dying because they can't afford it. In 1923, Frederick Banting and his team made one of the greatest medical breakthroughs in history. They sold the patent for insulin to the University of Toronto for a single dollar, declaring, "Insulin does not belong to me, it belongs to the world." Their dream was that no one would ever die for lack of access. But that dream was stolen. Today, just 3 companies, Eli Lilly, Novo Nordisk, and Sanofi, control 90% of the global insulin market. They have used a tactic called patent evergreening, making tiny tweaks to the formula to extend their monopolies for decades, blocking affordable generics. The drug that costs them less than $10 to produce is sold for hundreds. turning a gift to humanity into a multi-billion-dollar hostage situation.